Here are the top 10 U.S. states with the highest obesity rates, based on the latest statistics. 1. Mississippi. Mississippi consistently ranks as the state with the highest obesity rate in the country. A combination of poverty, limited access to healthy foods, and a lack of physical activity contribute to its high rates of obesity, which currently affect over 40% of adults. 2. West Virginia. West Virginia has one of the highest obesity rates in the U.S., with approximately 40% of adults classified as obese. The state's economic challenges and limited access to healthcare play a significant role in its obesity epidemic. Poor diet and sedentary lifestyles also exacerbate the problem. 3. Alabama. In Alabama, nearly 40% of adults are considered obese. The state struggles with high levels of poverty and limited access to healthy foods, especially in rural areas. Traditional Southern cuisine, which is often high in fats and sugars, also contributes to the high obesity rate. 4. Arkansas. Arkansas faces a growing obesity crisis, with nearly 40% of its adult population classified as obese. Factors such as low income, limited access to recreational facilities, and poor dietary habits all contribute to the state's high obesity rate. Rural areas in particular are hard hit. 5. Oklahoma. Oklahoma's obesity rate is slightly above 39%. Many residents face challenges in accessing healthy foods and maintaining regular physical activity. The state's high poverty rate and reliance on processed, calorie-dense foods further contribute to the obesity epidemic. 6. Kentucky. Kentucky has an obesity rate of about 39%, with many adults suffering from related health issues such as diabetes and heart disease. The state's high smoking rate, poor diet, and limited access to healthcare are significant contributing factors to its high levels of obesity. 7. Louisiana. With an obesity rate of around 38.5%, Louisiana faces significant health challenges. The state's rich cuisine, which is often high in fat and sugar, combined with limited physical activity, has contributed to rising obesity rates. Health disparities and poverty also play a role. 8. South Carolina. South Carolina has an adult obesity rate of approximately 38%. Many residents face limited access to healthy food options and physical activity opportunities, especially in rural areas. The state's high levels of poverty and healthcare access issues further contribute to its obesity crisis. 9. Indiana. Indiana's obesity rate hovers around 37.7%. Factors such as a sedentary lifestyle, reliance on processed foods, and a lack of public health initiatives to encourage physical activity contribute to the rising obesity rates in the state. Access to healthcare is another key issue. 10. North Dakota. North Dakota, while less populous, still faces a high obesity rate of about 37%. The state's rural population often lacks access to fresh, healthy foods, and physical activity levels tend to be lower due to long winters and isolated communities. Obesity rates in these states reflect a combination of economic, social, and cultural factors. The rise in obesity also correlates with increasing rates of diabetes, heart disease, and other health issues, placing significant strain on healthcare systems. Addressing these challenges will require public health initiatives, greater access to healthy foods, and increased opportunities for physical activity to reverse the trend.